Qualified, professional, and compassionate doctors talking real solutions to real health problems.
Good evening to you, our viewers. Dr. Gavin Nyanzi here, your host for your week's favorite health talk show, the Doctalk show. And it's the new year 2022, and it is our duty and our promise to always bring something very important. Like we always say, your health is your wealth. So we are always here looking out for those things that really matter to you. Please invite your friend, invite your family member, let them join in now. We are live streaming on our YouTube channel, the Doctalk show, as well as on our Facebook channel, the Doctalk show. Share this link. Let everybody join us this evening as we'll be discussing something very important because it concerns your health. This evening we're going to be talking about hernias. I know you've had hernias. I know in your community where you live or as you go home in the park, you must have had a megaphone somewhere, somebody talking about hernias. So we decided to look for a specialist to come and, address this issue to us. And I'm honored to introduce to us this evening our guest, Dr. Catheline Nagadya. She's a surgeon. Outside her medical work, she runs an organization, a non-profit organization called Girls Unstoppable. Well, I'll give her an opportunity to tell us more about herself. Dr. Catheline, you're welcome to the Doctalk show.
Thank you, Dr. Gavin.
Yes. I know you're going to talk about hernias. Surgeon, Girls Unstoppable, these are very interesting things. So maybe a minute or two. Please tell us about yourself in a minute.
Dr. Nagadya Catheline is my name. I'm a general surgeon. I am also passionate about educating marginalized adults and girls. So together with very many young people with generous hearts, we support girls to go to school, girls in secondary school through Girls Unstoppable Uganda. We have a dream of sponsoring 1,000 girls by the year 2026, and we believe that as we give them this education, we are empowering them to be people of significance in their communities, in this country, and as a result, the world.
Amazing, amazing there. Though this evening particularly, as always, we are here to talk about issues to do with your health. Back to you, Dr. Kathy. Hernias, every time I'm going home, I hear this thing, hernia. Hernia on some car moving, and they're telling me, you come here, we have a concoction that's going to help you, cure this hernia. Please help the people watching us this evening. What is hernia? Take us away, please.
So a hernia is usually a bulge of usually an internal organ or fat going through a weakness or a defect, or I can call it a hole in an abdominal cavity. These hernias are caused by different things, and the biggest cause is because we have an imbalance between pressure within that body cavity and a weakness or a hole that pushes this part of the organ or part of the body through that weakness or hole. So there are things that cause a person to have a weakness in that part of the body, and there are things that actually cause someone to have pressure increase within that part of the body or organ that would ultimately cause this organ or fat to go through, which we would call to herniate through. Yes, but also it can be herniating through somewhere else. That swelling can go somewhere else. It can go through maybe from, for example, we are going to see hernias where your intestine, part of your intestines, herniates through maybe region which we call the groin, somewhere in your private parts.
Okay, wow.
So it doesn't really have to be through the skin, but usually you see that swelling in the skin. But also you can have those hernias in other parts of the body. It is not just in the
abdomen.
It can be herniation in your brain. It can be herniation in your chest. Yes, so the hernias are very different. So sometimes these hernias are caused by, it is something you can be born with. You can be born with this weakness. Like in children, we see that around the umbilicus, they can sometimes have swollen things around the umbilicus.
Swollen, the umbilicus is swollen.
Yes. So that hernia is congenital. They were born with that defect. Yes. And sometimes it can close, sometimes it may not close. But also, as a person grows, and depending on the different things that they do. For example, if people are bodybuilders, people who lift a lot of heavy objects, people who are coughing a lot, for a prolonged period of time, people who have constipation, they increase pressure within their abdominal cavity, and that can cause that part of the organ to go through that weakness. Yes. Wow. And then you end up with that thing called hernia. So those different things, they are different things that cause, or what we would call risk factors, that cause weakness, and then things that increase pressure. So when you have these two things happening, a part of the organ can herniate through, and then we get what we call a hernia.
A hernia.
Yes.
Wow. So causes, we see somebody's work can predispose them to this, because we're talking about increase in pressure, for example, in the abdominal cavity. Dr. Kathy has told us about bodybuilders, people that have cough. Every time you cough, you're exerting a lot of pressure on your abdomen. So as it goes on, it can be able to cause these organs to go through. And so we have hernias. Yes. And so what types do we have?
Yes, so we have different types of these hernias. The most common ones that we usually see are the ones that happen in the groin. The groin is that part of your body which is just below your abdomen, leading
around
to the thigh, around the private parts there. So there you can have hernias, and those are what we call the groin hernias. You can also have the ones that we usually see, especially in children, the umbilical hernia around their umbilicus. You can also have a hernia happen when you've had previous surgery, where it goes through where they cut, that we would call an incisional hernia. Then
mothers after cesarean section,
or any other surgery. Any other surgery. Then you can have what we would call a hiatal hernia, which is you have your stomach going through the part where your food pipe enters the stomach. There is a hole, and then your stomach goes through, and it goes into your chest cavity. That is what we call a hiatal hernia. But however, there are other hernias that can happen even inside the abdomen, which we call internal hernias. But you can also have hernias in
where
other parts
an organ
of the body.
leaves its place. Normal place into another place.
Into another hole, another defect. But usually there is a defect, there is a weakness, and that thing passes through. Yes.
So what are the commonness of these hernias? What are the commonness of these hernias?
So hernias are common, especially in men. Maybe because men, you like lifting heavy things. Yes. They are
our
more
work
common.
involves a lot of exerting pressure onto our systems.
Yes. But also they can occur in women. So they occur in both men and women. They occur in all age groups. But the different types of hernias are seen more in certain people because of the different risk factors. For example, the umbilical hernias are more common in the children because at that point, that part of the abdomen has not closed off. Yes. But then most commonly, the groin hernias are the common ones, in majority of the population. And between the femoral, which is the femoral hernia is the one that happens at the point where your arteries, the big arteries, enter the thigh.
That's at the top of the thigh, between the abdomen and the thigh?
Yes, there is a part which we call the femoral triangle where your arteries, which we call the femoral arteries, actually do pass. So there you can also have things coming from your abdomen and going through that point. Those ones are more common in women, especially as they grow older. Yeah. Okay. Then the ones which
Dr.
are inguinal. Yes.
Wow. This is quite interesting and very good information. We're just going to pause at femoral hernia and then we'll be back so that we pick it up from there. Very exciting and new information for us this evening, and I hope you're really learning a lot. Please share the link, the Doctalk Show, on Facebook as well as YouTube, the Doctalk Show. Share this link with your friends. Invite them to come and join in this enriching session with knowledge. Special mention of our sponsors for this show, that is the National Medical Stores, as well as Catheline Men's Collection. Guys, if you're really planning to do any interview this year, Catheline Men's Collection is the place to go. Very wonderful suits, anything to do with men's wear, you'll get it there. They're located on Zebra Plaza. That's at the top of Entebbe Road along Kampala Road. And you'll be sorted. We'll take a minute break and we'll be back. Thank you.
You are watching the Doctalk Show.
It's time to learn. Schools are open. As a student, school life is going to be different. You must follow the COVID-19 prevention measures, which include always maintaining a 2-meter distance from others in class, dormitories, entertainment halls, school vans and playgrounds, regularly washing your hands with soap and water, wearing a washed and clean mask that covers your mouth and nose every day, and encouraging your classmates to do the same. Your teachers will also guide you on how to follow SOPs. Don't engage in violence with other students. Report any cases of abuse by teachers or other children to a senior teacher. Those who don't follow the rules should be immediately reported to a class teacher for correction and further guidance. If you experience flu-like symptoms such as a sore throat, fever, dry cough or body weakness, immediately seek medical attention from the school nurse and inform your class teacher. Whenever you sneeze or cough, please remember to cover your nose and mouth with a bent elbow, tissue or handkerchief. Let's share knowledge, not COVID-19. This message is supported by the Ministry of Health, Ministry of Education and Sports, and UNICEF. Stay safe.
You are watching the Doctalk Show.
Thank you so much for keeping it here with us this evening on the Doctalk Show. And this evening, we are discussing hernias. Please share that link with your friends. Let them know the Doctalk Show is running right now, for them not to miss out on this very important information. In studio with me this evening is none other than Dr. Catheline Nagadya, a surgeon here to dissect for us the issue of hernias. Before we broke off, Dr. Kathy, you were telling us about the commonest types. Commonest in men, maybe because of our work, but then some types are common in women. We broke off at a point where telling us about femoral hernia and it's common in women. Yeah, please take it on.
Yes. So we say that the groin and hernias are the commonest, really. And we have two types. We have what we call the inguinal hernias and the femoral hernias. And the femoral one is the one that where you have things coming from your abdomen and going into your thigh, but passing through a place that has the big vessels that are going to your thigh. Yeah, that is what we call the femoral hernia. And this hernia is more common in women, and especially the ones who are older, advanced in age. Yes, because there is weakness at that point. Like I said, weakness and pressure. Yes,
those are the main risk factors for a hernia. Weakness and pressure.
Yes. Then the inguinal hernias, which are common in actually all people, the inguinal go through what we call the inguinal canal. Yeah, it is also a passage of things coming from your abdomen into the thigh and into the scrotum. There are things, structures that pass there. So a man especially, they will have a hernia. An intestine comes from the abdomen and it goes, and sometimes it swells and it even makes the scrotum very big. Very big. So those are the commonest types of hernias. However, we also have other hernias, like I already mentioned, like the incisional hernias, which happen when someone has had previous surgeries. For example, you may have, you may even have been operated for another hernia before, but then there were weaknesses because when you're cutting, even if it is with using the very minimal laparoscopic way where we use keyhole surgery, and you create weakness because you cut through tissues.
Okay.
So that weakness, things can actually herniate through.
Has that got to do with the skill of the doctor, or who is trying to close up the wound, or it's the cutting itself causes the weakness?
Yes, cutting, because of course you're already interrupting the normal integrity of that part of the body. Yeah, okay. You've interrupted it, but as it is healing, it can heal and repair back, and that weakness is repaired. But sometimes you end up with a weakness. Yes. Okay. So that point will not be like the other parts that were not interrupted with, that were not cut. But of course, sometimes it is because of the way the surgery was actually done. If you did not close a certain layer of the abdomen, which is important to maintain that integrity, you end up creating that weakness. So those are the most common. Yeah, in children, the commonest is the umbilical hernia, but they can still get groin hernias. Okay. Yes. Then incisional hernias are common in people who have actually had surgeries before. Okay. Yes. Then the femoral hernias, we usually see them in old women. Then the inguinal ones, we can actually see them in all population, but they are most common in the men, and usually that hernia can go all the way to the scrotum. Yes.
Okay. Is it really a big problem in Uganda?
It is actually a very, very, very big problem, and I think that is the reason to why we are hearing so many people moving around with megaphones and asking people to actually come and get treatment, because it is actually a very big problem. And the fact that it is a surgical disease and surgical services are not everywhere
in the country,
that means that people will have this problem and they will not seek treatment early. So the burden of the disease is actually very, very high. Okay. Yes, so it is a very common surgical condition.
Okay.
Yes.
I know you're going to be telling us about how this is managed. And you've mentioned it's a surgical problem. That means usually management has to do with surgery. But many Ugandans out there, especially who are listening in, even actually I've seen on some TV stations, some radio programs, they're hosting some people, especially people that are into use or manufacturing of herbs, and they say you take this herb this number of times a day, blah, 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 and the hernia will go. Does it really work? Do the herbs work in the management of hernia?
When we are talking about treatment for cure, yeah, herbs don't work, yeah. But of course, like I'm going to mention, when we are talking about how these hernias do present, sometimes someone has symptoms, sometimes they don't have symptoms. Okay. You can be seeing.
Maybe actually we begin there. The presentation. How will somebody know that actually they have hernias?
Yes. So usually you just see a swelling. Yeah. For example, you've been walking all day. You get home, you're showering. You see that your scrotum is actually big. You go to bed, you wake up, it is small. Or it is at your umbilicus. You keep seeing your child. They have this thing that swells and goes away. Swells and goes away, yeah? Okay. That is usually the most common presentation. And usually when someone is not feeling any pain, they never actually come to hospital. So they can stay with their condition for so long. Then sometimes they start getting the pain and other presentations. And the pain usually happens when this organ that has gone through this defect gets trapped from there, and it fails to go back, and its blood supply reduces. Then someone will start feeling the pain.
The pain,
yes. Then when that goes on for some time, someone will end up with fevers. They end up, if it is an intestine that has been obstructed from there, they end up not passing stool. They start vomiting. And usually that is when people actually do come to hospital. But before they will tell you, oh, I have actually had this problem for so long. But it comes and goes. It comes and goes. After a long day, my scrotum is swollen. I wake up in the morning and it is okay. And they think it is
it is normal
for them. Yes, it is normal for them. And I think sometimes they never even talk about it, so they stay in that ignorance for so long until when that thing fails to go back and they start getting the pain, the vomiting, the distension of their abdomen, they fail to pass to, then they're like, oh, this is actually now a problem, then they come and see us. So that is the presentation.
Okay.
But also, hernias like the hiatal hernia, where we have your stomach going into your chest cavity. Sometimes those ones don't even give you any symptoms. Or when they do, people will complain of things like, I feel a heartburn when I eat food, when I lie down, depending on the eating habits, something like that. So that is how the different hernias actually do present. But the commonest presentation, especially with the ones where we are able to see, it is a swelling. And that swelling can be painful or not painful. Yes, and it can be reduced or not reduced. So
whereby it can be there all the time, or sometimes it comes and then it goes. Okay.
Yes.
Wow. So this actually emphasizes the fact that this is something we've been talking about almost every other time on this program. Please, it's very important that actually you check in with your doctors. Yes. Recommended is once every year, even if when you're not feeling well, you know. For example, for something that swells and goes back and you think it's normal, you may never pick it up. And by the time you pick it up, it's almost too late. Okay, maybe not too late, but it will be, if it was attended too much earlier, there would be a better outcome.
But even, Dr. Gavin, before you move on to the next point, some people can have very, very big scrotum, like they walk around with kilograms and kilograms of swellings. But because there is no pain and they are comfortable putting on their trousers, they never come to the hospital.
Oh my goodness.
And the intestines, they keep going down, and they know early in the morning, actually, this thing would have gone down. Then they get used to it, and someone will have their problem for so long. Then even the other side, a weakness is there, so you have someone's entire intestines, they are all in the scrotum. Yes.
Wow. Guys out there, probably somebody is watching us this evening and you've seen such a symptom, you need to see a doctor as soon as possible. It's not normal for you to have a very, very big scrotum. Dr. Kathy, we're going to take a short break and we'll be back in a minute. Thank you so much for keeping it with us. Carmeline's Men's Collection, thank you for making this show available to us every Thursday evening. We are taking a break. See you in a bit.
You are watching the Doctalk Show.
Where does it come from? That thing that makes us Ugandan. That thing that makes us different from everybody else. Where does it grow infinitely? Some say it's in our history, in our culture, and in our hearts, in our warm smiles and vast miles of coffee, dairy farmland, and amazing maize fields. It's in our inherent pursuit to always be better, to never stop growing and glowing. So you see, we are more than just a waving flag. We are a nation of sweat and skills, a nation of ideas and inventions. But what truly makes us Ugandan is our quest to improve the quality of life for Ugandans by creating sustainable jobs, businesses, and improving household incomes. That's what makes us Uganda Development Bank. Uganda Development Bank, inspiring development.
You are watching the Doctalk Show.
Thank you for keeping it here with us. This evening, we are here discussing issues to do with hernias, something that is very common. I know probably even this week you've heard somebody talk about hernias when you're in a taxi or driving at some point, you know. So it's a very important point. And before we broke off, Dr. Kathy, you were telling us about the different presentations.
Yes.
And truth be told, many people actually have this presentation and they stay for long and they think it's normal. But I hope after your sharing, people are now enlightened. So what happens? What are the complications? In case somebody delays to seek medical attention, what would be really the complications of this thing?
Like we said, you have a part of the body organ going through some place, some hole, some defect, yes? So when we take an example of our intestines, yeah, they have blood supply, things that keep them alive. So when this intestine goes through this defect, it gets constricted and the blood supply gets cut off. So when that blood supply gets cut off, that part of the body organ loses its nutrients. And when it loses nutrients, it dies off. Yeah. So when it dies off, someone will become more sick. Yes, they will become more sick. They will look to have fevers. Their pulse rates will be high, and also that part of the organ can perforate a hole can result from that point where the blood supply was cut off. You get a perforation. Then the things that are supposed to go through an intact intestine system, they pour into your abdomen. So you end up with infections, with peritonitis, you lose your electrolytes, yes? So it is important that we treat these people get surgery and treatment before the complications result. Because when someone comes to you and their intestine, its blood supply has already been cut off, their management is going to be more complicated than someone who comes to you and their hernia is still the one that goes and comes back.
And sometimes it may be too late.
Yes,
for the doctor to offer any help.
And then you can actually pass on. So it is important that people come to us. We actually get to diagnose them. We give them the treatment so that they don't have to get the complications and even potentially die.
Okay.
Yes.
So treatment, going back to my earlier question, do herbs treat hernia? Dr. Cathy, do herbs treat hernia?
Herbs do not treat hernia. Yes.
Wow, we've heard that from the doctor. Herbs do not treat hernia. She's emphasized hernia is only treated by surgery, like she's going to explain to us what exactly is done. So be careful to anybody trading around concoctions, that these concoctions will help you treat hernia. And usually those concoctions actually treat many other diseases. Please go and see your doctor. So how do we treat hernias?
Yes, so before we treat the hernia, we need to make a diagnosis.
To confirm that this is a hernia.
That actually this is the hernia you have, and what type and what are the risk factors. Because like, for example, if your hernia is because you've gotten a hernia because there is a lot of increased pressure, maybe from being overweight and obese, or from a chronic cough that you have, or because you're constipated, and I do my surgery, I have not removed the risk factor, so recurrence rate is going to be very high. So
the point we begin at is to actually get to know the cause of this hernia.
Yes, the risk
and try to address the risk factor. Okay.
The risk factor for this hernia, and then what type of hernia you have. Is it an emergency? Is it something that we can sort out at our own pace? Yes. And then we can actually do the surgery if we are going to do the surgery. So for us to be able to make a diagnosis that you actually have a hernia, usually just speaking to you and taking the kind of history from you and examination, the physical exams that we do in hospital are sufficient for us to actually make a diagnosis. And as we take that history and also examine you, we are able to know that this is an emergency that needs to be sorted out now, or this is something that can actually do it. People who need to be sorted immediately are people who are going to come with pain, and that pain is in increasing intensity. Like they say, hey, in the morning it was bearable. Right now I can't even sit. Yes, that means that the other thing that I told you, that we are cutting off blood supply to that organ, is actually worsening and happening. Then you will fail to reduce this, because for majority of the people this swelling comes and goes. So at this point where you fail to actually reduce it back into its normal cavity, that means this is an emergency that I need to sort out. Because when you fail to reduce it, like I said, blood supply will get cut off. You end up with all the other complications of the perforation, of the peritonitis, and even the death.
Oh, okay.
So as we examine and speak to you, we are able to actually tell that this is something we need to handle immediately, or this is something that we can plan and manage at our own pace together. Okay. Yes. So the best way to diagnose is by speaking to the person and examining them. But like I said, sometimes you do not see the swelling or that bulge. So then we will need to do some investigations. There are some tests we can do to diagnose.
Oh, okay.
For example, for hiatal hernia, we can do the x-rays you take when someone has swallowed a liquid that has color. That
can be seen on an x-ray.
Yes, so when that person lies down, you can see it going into the abdominal cavity. You can also do the endoscope where you look through someone's intestinal cavity with a camera and you make that diagnosis. Okay. Then there are also those other hernias that where you can't really see the bulge, and ultrasound scan can help. Then the complications that we talked about of the perforation and the peritonitis, or of the intestinal obstruction where your intestinal cavity is obstructed and you cannot pass stool. Those ones we can do an x-ray and we get diagnosed at what level is your complication so that we institute the right management. So that is how we actually get to diagnose a hernia.
Wow, and this management is available at every, for somebody like deep in the village. Are they able to get this management at their health center? For which kind of cadre is able to offer this management?
Yes. So
are they available?
To make a diagnosis, just to tell that person that actually you do have a hernia, it can be, the diagnosis can be made at a health center 3 level, because health center 3s are supposed to have clinical officers, right?
And very soon medical officers.
And very soon medical officers. So where the person can make a diagnosis, but then the facilities of, for example, doing the other investigations of the ultrasound scan, of the x-ray, those can only be done at facilities where those investigations are. But in majority of the people, just taking the history and the examination is sufficient. It is really sufficient. These are the ones that help us to really identify complications, or those hernias where you actually do not see a bulge. So I would recommend everyone to go to their nearest health facility to actually be examined so that they get a diagnosis. And the doctor there or the clinical officer there, they'll make the necessary referral to a health center, to a district hospital, or to a referral hospital for you to actually get
the appropriate management.
Yes, the appropriate management.
So, my dear friend who has been taking herbs, I think it's the right time. Tomorrow morning, please go to a medical center, go to a health center, and get the appropriate attention by a qualified medical personnel. Hernias, like Dr. Catheline has said, is a big problem, very common in our settings, especially that many of us in this country live in places where these facilities are not available. So many times we just leave it out, But there's an opportunity to any facility you go to, as low as Health Center 3, a medical personnel there can make the diagnosis and then actually do appropriate referral so that you get proper management. Have you, in your training or in your practice, I know some people come very late. Sometimes it's beyond the doctor's control. So what is it? Are people dying from this? Is it common happening? Or actually when they come, they are managed and they go home well?
Actually, the interesting bit is for someone who comes in with a hernia that still comes and goes back, the one that we would call non-complicated, and you opt to do surgery, it's day case surgery. So you come in the morning, you work on the person goes back home in the evening.
Wow.
Yes.
That's the one which comes and goes?
The one that is not complicated.
Oh, okay.
So you can actually work on them and they go
In
home.
the evening, they go home.
Not even in the evening, after
A few
resting
hours.
and yes,
Wow.
because this surgery, you can actually do it when we have not made all of you sleep,
Oh, okay.
depending on the type of the hernia. When we have not put you under general anesthesia, where we use local anesthesia to just control pain
Around the site
where we are working, and you go home.
Amazing.
Yes.
Hold it there. I'm going to pick it up from there after this short break. Please share the link if you've not yet shared, even as we get into our final segment of the evening. Thank you so much to Carmeline's Men's Collection. I'll say it over and over. Please visit that place if you've not yet visited. They are located at Zebra Plaza on top of Entebbe Road, where Entebbe Road intersects with Kampala Road. And you will be given a treat of your life this year. We'll be back in a moment. Thank you.
You are watching the Doctalk Show.
Mirinda.
Grab yourself an ice-cold bottle of Mirinda Orange at any shop or supermarket near you. Mirinda Orange, the taste that makes you go OMG.
You are watching the Doctalk Show.
Thank you so much for keeping it here with us. And for those that have been here, I hope the information being shared this evening is enlightening. Hope there have been some light bulb moments for you in this show. And if you've not yet invited your friend, there's still this opportunity to do so. Share the link with them, the Doctalk Show on YouTube, as well as on Facebook. And special recognition of our sponsors, the national medical stores that make available drugs and sundries across this country, as well as Cameline Men's Collection. Dr. Catheline, before we broke off, you were sharing, actually, you were able to do a day surgery and send somebody home.
Yes.
Please pick it up from there and tell us what kind of treatment is available for hernias.
Yes, thank you, Dr. Gavin. Like I mentioned, the kind of treatment will depend on how you present. So you can be complicated, where you have all these issues that I spoke about. The thing is not reducing anymore. You are not passing stool. You are having pain. You are vomiting. You look very sick, yeah? Or it can be uncomplicated, where we can even be reducing the swelling.
Okay.
So, of course, we will have to prepare you. And the level of preparation will depend on how you're presenting. So it is way, way easier for a person whose hernia is not complicated, it has not really worsened. So those people, we can actually do surgery for them as a day case.
They
yeah?
go home
So you
after
come early in the morning, we prepare you, you consent for theater, and we work on you. The surgery can be done under what we call local anesthesia, where we are only making numb the part where we are working on, or under general anesthesia, depending on your
condition,
on your selection also, and your comfort, because really anesthesia is to facilitate us to do surgery, but also you should be comfortable.
Sure.
So those are things we discuss through, and you choose which way we can actually work on you.
Okay.
Then we will allow you home.
Yeah.
And for an uncomplicated hernia, the patient doesn't even need lots of postoperative drugs. Just giving you a painkiller is sufficient. But then when you come in, when you're complicated, then surgery is going to be more complicated. And you may have to be admitted. You may have to stay in hospital for longer. And then what
that
we
increases
shall
expense
do, yes, which increases,
on your part.
Yes, which increases expenditure on your part. And also the kind of treatment we are going to give is going to depend on the complication we find.
Okay.
So for an uncomplicated person, we do what we call a herniography. A herniography is basically to repair that defect that we found. Yeah. So we repair it. We can repair it using sutures. We can repair it using a mesh. Okay. Yeah.
Sutures, those are the threads
yes,
in local language. Threads. And then the mesh would be like a net sort of?
Yes, a net,
cover up.
yes, depending on the size and the weakness that we find. Because as you're bringing these tissues together, as we are bringing these tissues together,
where the weakness is,
if they are weak, they will not be able to hold, so the hernia will happen again. So the mesh, yes, that net helps to reinforce, to give support to the repair that we are doing. And then sometimes the defect is so huge that you cannot bring, if for example, like those gentlemen who are having very big scrotal hernias, the defect is bigger, yes. So you may not be able to bring point A to point B under minimal tension, because you don't want to do the hernia repair under tension. The tissues will break down and it will recur. So
there you will also need a net.
Yes, you will also need that net. So it is dependent really on how you're presenting. But the bottom line, we have to repair that defect. Yes. Then when you have a complicated hernia, for example, if part of your intestine has already died, you will have to cut it away.
That particular part that has died.
Yes, that has died. And of course your hospital stay is going to be longer. You may even get complications from that cutting away of that part. It can break down. Then remember, if you had a perforation, things have already spilled into your abdomen, you're at risk of infections. So really, it is always best that we repair these hernias when they are not complicated. As we are still in the community, my thing comes and goes. That is the best time to actually
seek medical attention.
Yes, and have it repaired. And there are different ways to actually do this surgery. We can do it open, or we can do it as keyhole, where we use microscopes and tiny instruments that we pass through holes and it gets repaired. And those things are possible in our country. In our generation, we are able to do those things right here.
At different hospitals?
At different hospitals.
Like Seguku?
Yes, like Doctor's Hospital, Seguku. So these things are very, very possible. And then we will treat you for the complications. But like I said earlier on, there are those things that give you risk. For example, you have had this chronic cough, you are obese and overweight, you're constipated, you're straining all the time, you're increasing pressure in your abdominal cavity. So it is also important that as we repair your hernia, we also work on the risk factors. Yes. So things like advising you to have a healthy lifestyle, losing weight, treating that cough that chronic cough that you've had, making sure that you don't have to strain as you're passing stool. It is also part of the Of the management. So that the hernia doesn't recur. Yes, because if I just repair and I do not work on the things that caused this thing to happen in the first place, I'll be back
next month.
You're going to be back very soon. And that repair is going to be more complex than the first one before I touched anything. So it is always important to do both of them. As you're treating what has brought the person, you also work on the risk factors for this condition.
So can we prevent hernias from happening in the first place? How can we avoid hernias?
Yes.
It's a big problem.
Yes, it is a big problem. And we have already talked about some of the risk factors. So the first thing to do is to prevent or to reduce on the risk factors. Let us maintain an ideal body weight.
Ideal body weight.
Yes.
Your weight is a factor of your height. When you're grown, your height is sometimes at a certain point your height stops. And that particular height is supposed to have a particular weight. So many times when we go beyond that weight, we have a problem. Very good.
Yes. So let's maintain a health lifestyle, really. But also when you start getting chronic things, you've been coughing for 2 weeks, 3 weeks, 4 weeks, you're continuing to cough, you should come and seek medical attention, because every time you keep coughing, you increase pressure in your abdomen, and that gives way to things to go through the weak points that are already there. Of course, some things we can't work on them, like the fact that we age at some point. And of course, as we are aging, body tissues also become weak. They become weak. That we can't do. But of course, if a person is aged and they are not having a chronic cough, at least we are eliminating one of the factors.
Oh, okay.
So that person will not end up having a hernia. Then, of course, we talked about other things that we usually do, like lifting heavy things.
Are you chasing us out of the gym?
I would believe that the people who we work with in the gym, they give you
particular techniques.
Particular techniques to
manage.
Yes, to manage your pressures in the abdomen.
Oh, okay.
Yes, but heavy lifting of heavy objects. Let me say I am a person who lifts sacks of potatoes in the market, things like that. That is a predisposing factor. So people shouldn't get surprised that 10 years down the road, they actually have hernias because you've been lifting heavy things. That is the kind of work you're doing. Unfortunately, in our economy, we may not be able to tell people not to lift things because they need a living and a livelihood. Yes,
oh, yeah.
But they should know that this is actually a risk
predisposing
factor.
Them to
then
hernias.
we talked about incisional hernias. So also being aware that this is something that can happen is also important.
So this is information to the medical people.
Yes.
To do a good job.
Yes, they should do a good job, like close the tissues that are supposed to be closed properly so that, you reinforce the integrity of where we have operated on. But also, we have to know that it doesn't entirely depend on the fact that the person didn't do a good job. Okay. It is just a contributing factor. Yeah. So people should actually be aware. Okay. Yes. So the way we operate on our patients and then the people should actually be aware that, you know what, I can actually end up with a weakness and this would be a very probable point for the hernia to actually happen, and we look out for them. But most importantly, let us get diagnosed and this condition addressed very, very quickly.
Let us do at least once in a year visit to the for medical checkup.
Yes, come in, we will be able to examine you, because you see for a hernia, you just tell someone, cough, 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 because you increase the pressure, and if there is a weakness, the bulge will appear. So we are able to even diagnose. If you're not the person who is a friend to your body, you don't see it, we can actually help you make the diagnosis.
Wow.
Yes.
What a great evening. Full of information, full of new knowledge and enlightening stuff. Thank you so much, Dr. Catheline.
Thank you.
As we come to a close, any parting shots to our viewers?
Thank you so much for tuning in this evening to the Doctalk show. We are really very grateful. We expect you to actually come in and be examined. We talk to you to diagnose hernias early and any other medical conditions, but most importantly to treat you early so that we avoid the complications, the death that can result from seeking medical help late, and also the morbidities that can result from having sought medical help late. So early diagnosis is really, really key. Thank you.
Wow, I would love to go on and on and on and on, but our time, unfortunately, is up. My take-home point, hernias are not treated by herbs. Hernias are managed in hospital through surgery. So please, hernias are managed in hospitals through surgery. It's a problem around us, but actually manageable. Pass on that information to your neighbors and friends that have not been able to participate, but share the link. And if you have any questions, please leave them in the comment section below on Facebook and on YouTube. Thank you so much to National Medical Stores as well as Camelin Men's Collection for always availing this show to us every Thursday in your house or on your phones. We are done for today. We will be back again next Thursday. God bless you so much. Keep going in 2022. Bye for now.
The Doctalk Show.